the high-flying, high-energy world of professional wrestling, injuries are a part of the game. And today, we're all going to play the role of ringside physician as we continue to deepen our understanding of human anatomy. Please note, all depictions of injury and trauma in this video are carefully contextualized within a lesson on human anatomy. I'm talking to you, YouTube reviewer. I'm talking to you, bro. Big shout out to Tap Out Corner here on YouTube, who originally compiled many of the clips we'll be looking at in today's video.
During the match, Stratton hit a senton on Indy and Roxanne.
Oh,
Chris is fine, but Indy Hartwell's right leg got crushed due to how it was positioned.
When you look at the slow motion replay of this video, you see that her ankle has gone almost directly into dorsiflexion, meaning that she has bent her ankle but in the direction that it is meant to go. Even though the amount of dorsiflexion is extreme, still it's in the direction that the ankle was meant to go. And if you look at the ankle is primarily a hinge joint. The ankle is really only able to tolerate excessive flexion and extension. That's it. Most of the ankle fractures or ankle injuries occur when you combine rotation and flexion, rotation and extension, inversion and rotation, eversion and rotation. Those combinations, which are movements outside of the normal range of motion of the ankle, are what will normally cause an ankle fracture or an ankle dislocation. Because she was forced primarily into dorsiflexion, this is what saved her. And for that reason, she is extremely lucky.
Off the top. Wait a minute, Book. I don't know if you saw, but Indy
she was really fortunate there.
Grabbing at her right ankle.
And we know that she doesn't have a fracture because here we can see her running back into the ring. She's able to actually weight bear on her injured extremity. And this is actually one of the rules that we use when we try to determine when someone comes into the emergency department whether we need to x-ray them or not. These are called the Ottawa ankle rules. Shout out to Ottawa 613. You kind of go through this checklist, and then if you answer yes to any number of those questions, then that's an indication that the patient requires an x-ray. And so one of the questions is, are they able to actually weight bear? And if they're able to weight bear or walk or put weight on that extremity, then although it is injured, generally speaking, it's not going to be broken. None of this was enough to deter Indy from finishing the match. And after the medical team checked her out backstage, she rushed back into action, albeit with a noticeable limp.
Wait a minute, there's Hartwell on one leg. Hartwell breaks it up, and you talk about grit.
Indy shared the aftermath on social media as well as clips of the recovery process. And certainly you can see here with all the bruising that has gone down into the lower aspect of the ankle and foot. You know, she suffered some kind of soft tissue injury there. When you have a soft tissue injury, you're gonna have some bleeding that's associated with that. Over time, it will start to descend through the tissue and down to the lowest part of the body. So you can see all of that blood working its way down to the foot. So let's see what she's doing here for recovery. She's working on range of motion, strengthening. She's strengthening the intrinsics. She's got a little ice going there as well. And then we can see she's got some lower extremity strengthening in general. All in all, it's a pretty good result for what could have been much, much worse. She could have had a fracture, and in that position, she almost certainly would have had a bimalleolar fracture of the ankle, meaning both sides on the inside and the outside, and she would have required surgery. So she got off real lucky. Since Indy never underwent surgery for her injury, we can safely assume that she did not suffer any fractures or dislocations. Up next, we have another injury caused by a high-flying leap out of the ring. And yet again, the person injured is the one doing the catching.
Kofi Kingston, Xavier Woods, and Knight ended up on the outside, so Drew decided to take a dive. However, the three men were not.
That's a 265-pound human torpedo front flipping over the rope. That ought to end well.
Three men were not positioned correctly, and Kofi took the brunt of the impact. While Drew was safe, Kofi's ankle got injured as a result.
Yeah, Okay, no doubt. And so here you can see that unlike the previous case with Indy, we now have the ankle going into one of those previously mentioned directions that it's not supposed to go. Recap, the ankle is a hinge joint which is supposed to do plantar flexion and dorsiflexion and maybe a tiny little bit of side-to-side rotation. That's it. And in case you missed that, Kofi posted this on his social media. There you go, air cast. So when you look at the slow motion here, we can actually see that it is not external rotation and eversion, but mostly abduction, meaning that the ankle is angled straight to the side away from the body, or abduction. Yeah, so we can see the x-ray here, and that shows a small fracture at the anterior or front part of the distal tibia. And interestingly enough, that piece of bone that is there is not actually supposed to be there. It's not normally there in most individuals. Not only do we learn about his injury, but we also learn about potentially injuries that he's had in the past, because that piece of bone there is an extra piece of bone, what we call a reactive osteophyte. And so that's a piece of bone that has developed over time in a location where it's not supposed to as a result of repetitive trauma in that area. And so that piece of bone being there tells me that he has had in the past a problem called anterior ankle impingement, where the top of his foot has been forced upwards, just kind of like what happened in the first clip with Indy when he had this injury on this occasion by a different injury mechanism. That piece of bone was fractured off. I gotta say that I'm really appreciative when athletes are open about their injury and recovery process. Not only is this stuff interesting, but we can learn a lot from what they share with us. So we can see here, you know, all the swelling. See that, boom. There was a significant amount of swelling that he had after his injury and before he had surgery. Then we see here that he's got a number of incisions, which shows that he's had surgery. So this tells me that he's had 2 procedures performed. So number 1, he has had a removal of that piece of bone that was in the front part of his ankle, and he's had that removed arthroscopically through those 2 little poke holes in the front. But then after that, they then went on and performed an open procedure on the medial aspect of the ankle, the inside part of the ankle, and then they performed a repair of the deltoid ligament. Now, it's important to note that we don't always repair the deltoid, and in fact, for many ankle injuries, we allow the deltoid, which is generally part of the capsule of the ankle, to heal on its own. But in this case, given what he does for a living, which is very vigorous, the instability that he likely had after that would be a significant detriment to him in the future. And so they decided to repair the deltoid ligament directly. So here we can see them taking out all of his sutures. His wounds look pretty good there. So at this point, we can see all of his incisions. They look to be healing quite well. But of course, this is only the beginning of the recovery process. And sometimes complications do occur. So we can see that he has some swelling here. He's had a post-operative wound infection. And one of the things that we can see is all that kind of whitish tissue there around the incision, which tells me that he got his incision wet when he wasn't supposed to. And that was probably a contributing factor to the reason why he got an infection there. I'm very conservative when it comes to my post-operative dressings and my post-operative incision care. And so I tell people to keep their dressing on for 2 weeks. And I know people don't like it because they can't shower or whatever, or they have to take sponge baths. Ultimately, it's for the patient's own benefit, because I want to make sure that wound stays as clean and as dry as possible. So he's getting a little rehab action there, some TENS, laser surgery, and we can see that he's going through some range of motion exercises and some strengthening. And then here, August 7th, 2023, 5 months later, and he's walking around, running around as if nothing ever happened. Nice. To be returning to his sport or to his occupation after only 5 months is pretty quick, actually. Generally speaking, when you have either a fracture or a ligament type of repair, we're going to keep the ankle immobilized for a period of about 6 to 8 weeks. And then after that, you need to restore normal range of motion of that joint, which will take, again, probably another 6 weeks or so. So right there, we're already talking 3 to 4 months. And then you have to restore strength and functional activity. Now we're looking at 4.5 months, and then another couple of weeks, to a month or so to start to restore functional activity. Yeah, so we're looking at easily 6 months. So for him to have returned to function after 5 months, I think, man, that's a job well done. Kudos to him and his rehab team for the work that they did. Awesome result. So I wonder what we have next.
One WrestleMania injury was so severe that it required 14 staples to close the wound.
All right, Hell in a Cell, Finn Balor versus Edge. As you might safely assume, the added layers of weapons and anything goes rules can definitely exacerbate the risk of injury. Oh my God. A ladder to the face, jeez. Oh my gosh. That's ridiculous, bro.
The impact caused Finn Balor's head to get busted open, and
no
paramedics
doubt
had to get in and check on Finn immediately. The injury only got worse and worse.
Now,
as the match
I think
progressed.
it's hilarious that they're focusing on the laceration that's on his head, because clearly, if he had a laceration that was large enough that it required attention in the middle of the match, then the blow that caused that laceration was probably quite severe. And I would be more concerned about whether my man has a concussion or some kind of closed head injury rather than does he just have a laceration. But hey, that's just me. I'm just like a surgeon type of guy. But ultimately, they decided to let the match continue. Afterwards, Balor posted an image to Instagram with the caption, "Just a flesh wound." Sounds like something out of Monty Python, doesn't it? Blurred for the sake of the almighty algorithm, but enough to see a gash at least as long as a thumb and the width of a pencil. Probably 10 to 12 centimeters. Oh boy. We know that this gash was addressed with some 14 staples, thanks to the merch Balor made to commemorate the occasion. I'm a little bit curious here as to why they decided to use staples rather than sutures, but perhaps they decided to do so for expediency, because it would certainly be quicker to put in staples than it would be to do the sutures, or it just may have been that they did not have a physician or medical personnel who were adequately trained to do stitches manually. Though our next injury is more severe, it will likely require less than 14 stitches or staples once everything is said and done.
Dakota Kai tore her ACL when she performed a tag team move with Bailey.
Okay, yeah,
Instantly,
that's gotta hurt. It's a little bit hard to see here, actually, what the mechanism of injury is.
This is where the veteran instincts of Bailey really come to the fore.
Bam!
Oh my goodness!
Yeah. So certainly that view, you can see it quite a bit better. So here we have Dakota Kai jumping off the top rope. So we can see that her right leg is slightly in front of her left leg when she actually contacts the surface of the ring. She's kind of off balance because she's hanging on to somebody as she flies through the air. She starts to fall forward over top of her foot and her knee, causing her knee to go into hyperextension. And so if you know anything about the ACL ligament, the ACL and the PCL are two ligaments that cross each other inside the middle of the knee in an area called the notch. When you have the knee go into extension, or hyperextension, that front aspect of the notch, or the end of the bone here, can then come down and clip into the ACL while it's under tension. And so that combination of having the ACL stretched under tension and then having this blunt object come and then press down on it while it's extended is a killer combination. And so you can either have the ACL rip off the end of the femur at the top, or you can have it break within the substance of the ACL itself, somewhere along its length, quite frequently within the middle of the ACL. So that's generally the mechanism of injury here. Now, although there are a small subset of people, probably somewhere around 5% of the people who suffer this injury, that can recover from a torn ACL and then return to a high level of sports or high level of activity without surgery. For most people, if they want to return to a high level of competitive sport or anything that requires jumping, pivoting, cutting, quick change of direction, a fully torn ACL must be fixed operatively. If you don't do that, you're going to have ongoing instability of the knee, and every time your knee goes in or out, you risk causing more injury to other structures in the knee. ACL reconstruction is pretty much a must for high-level athletes. There are a number of ways in which we can repair the ACL, and the different options come down to the operative technique and to the graft choice. And so there are three main grafts that we use for ACL reconstruction: the hamstring tendon, the patellar tendon, and the quadricep tendon. And so those are the three types of grafts that come from the patient themselves. So this is what's called an autograft. Some surgeons will use what's called an allograft, which is a graft from a donor. Studies have shown that those grafts are much more prone to re-rupture than any type of autograft. So unless we're forced to, we generally try not to use allografts for this population of patient. But whatever graft you use, generally the healing time after an ACL reconstruction is approximately 1 year before you can return back to sport. For Dakota Kai, this process began in May when she underwent surgery. So we know that this is relatively soon after surgery because she still has her bandages on to cover up her surgical site and the surgical incision. And it also looks like she has a cryo cuff there. It's a device that you can circulate ice cold water through, which helps to keep everything relatively comfortable and to minimize the swelling post-operatively. This is part of her recovery, early post-operative recovery. Still got her post-op socks on as well. Dakota Kai has been spotted ringside with her teammates several times since the operation, which led to various social media detectives to call her injury fake. In her Twitch stream under the nickname Charlie Girl, Kai responded, "I'm so sick of seeing people saying she can run and jump, but she's not cleared still. No, that's not how it works. Obviously, I can run and jump because I've been doing it for the last few months, but they have a set date for when you are actually cleared because I still have to do matches and they have to check all the boxes of when I'm actually cleared. I'm not going to be in a wheelchair for 9 months and then suddenly stand up and go, I'm cured. That's not how it works." And she's absolutely right. In order to be cleared for a high-level athletic performance, an athlete must typically pass a number of return to sports tests. There are a number of different tests that can be used to determine an athlete's readiness to return to sport. The one that I use is called the Melbourne 2.0 ACL Rehabilitation Guide, and it has a series of tests that the athlete can perform after 9 to 12 months to determine their readiness to return to sport. I love using this method instead because basically it's really objective. It's numbers, man. So they know beforehand what are the tests that they have to do, which are a series of running, cutting, and jumping tests. And you basically will compare the operative leg with the non-operative leg. And they know beforehand what are the tests, and they know the numbers that they need to achieve, how close to their non-operative side they need to get in order for them to pass the test. So they know that all beforehand. You actually have them perform the test, and you basically calculate the numbers. And you can say, hey, either you passed or you did not. And it's not you as physicians that's telling them that they can't return to sport or that they can, it's the numbers. It leaves me out of the equation. So they can't get mad at me. They can only be upset with themselves. So for these types of athletes, the recovery process will entail less strenuous gradations of what they will be doing when they return to action. So we're really working them up to their sport. In Dakota's case, running and jumping must be part of the recovery protocol. Recovery, though, must also include things like jumping, pivoting, and rolling, kicking, because these are things that she does on a day-to-day basis as a wrestling athlete. We see here that she posted an update into her Twitter in June 2023, where she is already out of her brace. Granted, not yet able to fully squat or weight bear on her injured right leg. At this point, she was probably working towards full range of motion, both flexion and extension. Long way to go, baby, long way to go. Boom! Ah!
However,
Yeah. Bam!
and ended up landing
Just like into the boards, baby. That's gotta hurt. I know, because I'm speaking from experience, bro. Had it myself. Prince was officially put on the injury reserve with a separated shoulder. So let's have another look. Off to the side, boom. So that was the whole problem right there. When he was thrown over, he basically didn't square himself up. So he was thrown off one shoulder and rotated through the air. So instead of landing directly on his back, which is probably how this stunt was supposed to occur, he ended up landing directly onto his shoulder. This injury mechanism is the exactly same as hockey players who get checked into the boards and then they basically hit the boards directly with their shoulder, which forces the end of the shoulder to drop down while the clavicle is still moving in the direction towards the boards. And either one of two things is going to happen, either a shoulder separation or a clavicle fracture. And although I would have thought that Prince was just unable to continue, throughout the remainder of the match, he could be seen grasping his left shoulder, clearly aware that something was wrong. Brother, just take a break, man. Now, there are several ways in which this injury can be treated, but it depends on the severity or the level of injury that has occurred. And if you look at shoulder separations as a whole, there is a grading system, 1 through 6, type 1 through type 6. And they really just speak to the level of severity of the injury. Generally speaking, most shoulder separations are either types 1 or types 2, which are relatively low grade injuries where some of the ligaments around the AC joint have been torn or stretched, but not all. The first injury of any significant severity is type 3. Types 1 and 2, those can generally be treated non-operatively with sling immobilization for 4 to 6 weeks and then a gradual return to your level of activities. And you might have a little bump on that side afterwards. Once you start to get into the higher grades, 3 through 6, all of those speak to a higher degree of displacement of the clavicle. And for myself here, I had previously had a type 3 separation of my left shoulder. In my case, I didn't have surgery for this because I was playing football at the time and I wanted to continue playing. But certainly a type 3 could be treated operatively. I couldn't find any evidence that Prince actually underwent surgery, so at least Pretty Deadly made the best of it in the post-fight interview. But Pretty Deadly is known to be dramatic. So now, immediately following the injury, the sling will help to support the arm so that you don't have the weight of the arm pulling down at the level of the AC joint against the injured ligaments. Whitman was a little bit ambitious here. The actual recovery time is more like 6 to 8 weeks in total. Although it takes probably about 4 to 6 weeks for the ligaments to heal, then it takes a couple of weeks for you to actually restore your range of motion and your normal function afterwards. So yeah, a lot longer than he said. Which plays into Elton Prince's confident character. Thus, was he able to make a miraculous recovery?
It's just a separated shoulder. There's no reason that he would be here unconscious or unable to walk.
But he'll need to incorporate plenty of rehab, prehab, and strength work moving forward in order to avoid this happening again.
Unless he's pretending.
Up next, we'll take a look at CM Punk's recent tricep injury.
Right arm in a sling. Pat, there has been rumors all over social media of an injury sustained by CM Punk.
He's got a bandage there. Bandage.
I tore my right
got the
tricep.
sling. Surprisingly, the fall that caused the injury, torn triceps, is perhaps the most unassuming one that we've seen in this video. Boom. Ah. Boom. Did you catch that? Boom. Ah, there you go. From this angle, we can see that Edge falls onto his forearm with his elbow in a flexed position. And with Edge falling to the canvas while trying to decelerate himself with his forearm, we end up with a eccentric contraction of the tricep, where the tricep is trying to contract itself while it's in fact getting longer, which is the most difficult type of contraction for the tendon to accommodate. We see CM crawl to the corner of the ring and collapse towards the mat, likely in a combination of shock and pain. Cause yeah, that's gotta hurt.
And as much as I tried and I asked, maybe I can just tape it. Maybe I can make it to Elimination Chamber, but it's just not in the cards.
This is the type of injury that really puts injury into perspective. Once the tricep tendon is torn, the arm suffers pretty extreme loss of function because you can't extend the arm.
That's gotta be racist. There's no way.
The triceps is the main extender of the elbow after all. And once this happens, surgery is our only realistic option. He took to Instagram to update fans on the day of the operation.
Today's surgery day. It's always a fun day.
A nice big breath in and out.
So a triceps repair is generally a type of procedure that we're going to perform through an open incision. This is not the type of injury that you can repair arthroscopically. And once we open up the incision, the goal is to find the ends of the tricep tendon. We'll have to debride that tendon to clean it up, to make it look better, till we have good tissue. Usually what's gonna happen is that we're gonna make either bone tunnels in the end of the olecranon, or we're going to insert suture anchors into the end of the olecranon, to which are a connected suture that we can then use to grasp the tendon and sew it back down to the bone. This is something that has to be done as an open procedure. Once we've repaired that, we would close up the skin in layers, put a dressing on, and then we would put the arm either in a sling, or we might put the arm in a splint where we kept the arm in a partially extended state to minimize the tension on the triceps muscle, and then we'd be able to allow the tendon to heal back to the bone, which is going to take about 6 to 8 weeks before we start to allow range of motion, rehabilitation, physiotherapy, and ultimately after an additional 6 to 8 weeks, then strengthening.
This is the most frustrating thing. Little simple tasks like this. I'm in a lot of pain. It's mental more than anything. I can handle the pain.
The pain associated with this procedure is most pronounced immediately following surgery, during the first week or so. And although drugs may help, there's not really much that we can do about that. You just kind of have to grin and bear it. The body knows something is wrong as it directs resources to begin the healing.
I can power through hard PT. The mental aspect of it, I think, it's a lot harder than the physical. The
brace that Edge is wearing will serve to protect the surgical repair. And this is just to make sure that it will prevent him from going into more flexion to put tension onto the repaired tissues. After approximately 6 to 8 weeks, once we can be confident that the tendon has repaired or has healed back to the bone, then we can start the rehabilitation process. And the recovery process will initially entail restoration of the range of motion, because the elbow will be relatively stiff because we've kept it in extension or partial extension for an extended period of time.
Go and check my mail over there.
You been lifting weights?
No.
Of all the joints in the body, the elbow is the one that is the worst for post-operative stiffness after a surgery. And it's the one where it is the most difficult to restore range of motion. So he's gonna have lots of work with that. So the whole recovery process is gonna take, somewhere in the neighborhood of 5 to 6 months before he's able to start using his arm to do his regular tasks. But to be honest, the whole recovery before it's something that he doesn't even really think about anymore is probably gonna be closer to a year.
This is a bump in the road. It is adversity, and I have overcome adversity countless times in the past.
I'll tell you one thing. In the recovery process following a major injury such as this, a little grit and tenacity goes a freaking long way. I'm wishing CM Punk and all the other athletes from today's video a speedy recovery, for those still recovering, and a long, healthy career. Shout out once again to Tap Out Corner for the compilation of injuries. If you enjoyed the video, be sure to subscribe and give it a big thumbs up to feed the algorithm. And if you are already subscribed, make sure that YouTube didn't unsubscribe you from the channel, because, sometimes they do that, bro. We are well on our way to 600K subs, so we don't want to lose any interns along the way. If you didn't like the video, be sure to let me know why in the comment section down below. I read as many comments as I can, and we use your feedback to make our videos better for you. Of course, don't forget to follow my gym, Cuba 2.0 Fitness, for free right here on YouTube, where we post content that helps you move better and prevent injury, like the ones you saw in this video. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one.